The end of June, he started complaining about his throat, and I took him to the pediatrician multiple times, at least once a week. Basically, by the fourth time, they threw me out and said, you know, the kid's fine.
You know, your insurance will not cover PANS, PANDAS in the state of California. You cannot say your child has PANDAS. Insurance will deny. And I put up a post through, I think, San Diego, PANS support group in Los Angeles that just said, who's sick and tired of being sick and tired and wants to start a legislative advocacy group with me?
Thank you, Mr. Chair and members. I am pleased to present AB 907, which requires a healthcare service plan contract.
Treating California kids with PANDAS and PANS, which are forms of autoimmune encephalitis. When PANS strikes, a child's brain is attacked by misguided antibodies. Overnight, a child can be devastated by what looks like psychiatric disease, with the illness destroying an entire family's ability to function.
That is why we were shocked when our insurance denied IVIG, saying it was not medically necessary.
A typical delay in receiving IVIG due to insurance denials is usually measured in months, if not years.
My name is Shari Strolson. I'm a mom of a PANS child, and I strongly support AB 907.
My name is Dr. Angela Tang. I'm an adjunct professor with Stanford PANS Clinic. I urge you to support AB 907.
Thank you for the very thoughtful comments. Really appreciate them and respectfully ask for your aye vote.
Thank you very much.
All right, members, we're going to start to move to business on the daily file. This is file item 152, AB 907. And Senator Lowenthal, you may open on the bill.
Thank you, Mr. Chair and members. AB 907 will ensure that individuals and families who are confronted with these disorders do not experience unnecessary delays in treatment that can lead to disastrous and tragic outcomes. I respectfully ask for your aye vote.
Thank you, Mr. Lowenthal. And seeing no members wishing to be recognized on this bill, clerk will open the roll. All those vote who desire to vote. All those vote who desire to vote.
It just passed.
Clerk will close roll, tally the votes. Bill's passed.
Okay, the Senate Health Committee will come to order. Here today on PANDAS and PANS, Mr. Lowenthal.
Thank you, Madam Chair and Senators. It's my pleasure to introduce April Renee and Dr. Tempeh Chen, who are here to testify in support of AB 907.
April Renee.
Hi, I'm April Renee. I'm a second grade school teacher and mom to a PANS child. My beautiful son Aiden was a healthy, vibrant 8-year-old when he got pneumonia 9 years ago. He woke up a completely different child, consumed by OCD, hallucinations, and extreme anxiety. Right now, 11 states have laws like AB 907. Meanwhile, California families can't access life-saving medicine despite having 2 leading PANS clinics, UCLA and Stanford.
I've seen the dramatic recoveries from IVIG, yet every request for IVIG gets denied.
My name is Carla Aceves. I'm a PANS mom, speech language pathology assistant. I strongly support AB 907. I'm a member of the California Coalition, and my daughter's here today.
Thank you very much.
I'm a PANDAS survivor. My name is Mia Aceves, and I strongly support this bill.
Assembly Bill 907 by Assemblymember Lowenthal, and Act relating to healthcare coverage.
Senator Gonzalez.
Thank you, Mr. President and members. I rise today to present AB 907 on behalf of Assemblymember Lowenthal. PANDAS and PANS are inflammatory diseases of the brain that result in sudden onset behavioral and neurological dysfunction. And despite PANDAS and PANS treatment guidelines that established the standard of care in 2017, health insurance plans forbid authorization of these treatments. I respectfully ask for an aye vote.
Any further discussion or debate on this item? Hearing and seeing none, Secretary, please call the roll. Ayes 33, noes 0. The measure passes.
Okay, from the Office of the Governor, October 7th, 2023.
To the members of the California State Assembly,
I am returning Assembly Bill 907 without my signature.
While I support the author's goal of ensuring that children with PANS and PANDAS receive the treatment they need in a timely manner,
this bill creates a disease-specific mandate and contains provisions that would be duplicative.
Further, this bill removes the medical necessity requirement.
For these reasons, I cannot sign this bill.
I cannot sign this bill.
Sincerely, Gavin Newsom.
my first reaction would be, I don't get it.
I was in disbelief.
It felt a bit like I had been punched in the gut.
The first thing that happened was I had a good cry. We have a situation in our state right now where our insurance system is in crisis. We have utmost faith that our governor is knowledgeable on these issues, and I know that he wants to find relief for these families as well.
Are you going to give up?
No. I wish I could. But if my child can fight like this, I can fight back. And it just makes me angrier. I'm not ever going to give up until this becomes a law.